Okay, yeah, now it's recording.
You can turn this way if you want, Dale. Be more comfortable.
Okay, ready?
Seafood has wonderful Christmas gift items too, such as nautical wind chimes, ornaments for your Christmas tree,
Alright.
cookbooks, plenty of cookbooks, and pearls of wisdom from an oyster shell.
I'm doing this by habit. I don't know why I'm moving the microphone close to me. I'm not talking. I just do that.
If you want to, you can jump on in.
Yeah, I wouldn't know what I'm about to say though. It's your department.
So I'll do the kind of let you know that we'll jump to commercial.
Yeah, just let me know when you want to do a break.
Alright,
I've got it ready.
Investment advisory services offered.
We're live here on What Your Money Would Say. I'm your host, Andrew McNair, and for the next 30 minutes, every Saturday from 12:30 to 1 o'clock, we'll be taking financial chickens and making them financial swans, because we believe as a retiree, you deserve to sleep well at night. After working 30 years and saving in your 401k plan, putting 3 kids through college, and even giving to your local charities in your church, it's time for you to sleep well at night as a retiree. And we're going to talk about a process that many families will endure either with their spouse or a loved one, and that you need to be prepared for in retirement. And that's hospice. And I'm going to bring on Dale Nee from Covenant Hospice to explain to you how that process goes so we can take the unfamiliar and make it familiar before you ever get there in life. But before we do that, I want to share with you an upcoming event that we have here at SWAN-Capital, and that is our Veteran Aid and Attendance Workshop. We're going to share with families how to receive up to $24,000 a year from the VA if you're a wartime veteran and you're paying for either assisted living, skilled nursing, or home health care expenses. And our next workshop is coming up at Homestead Village in Pensacola on Pine Forest Road. It's going to be this coming up Tuesday. That's going to be the 10th at 6 o'clock. If you want to find out more information on that workshop, or would just like to look at some other times, check out our website at swan-capital.com. That's swan-capital.com, and check out the upcoming events tab. And while you're there, like us on Facebook, follow us on Twitter, and sign up for our weekly market update so you can stay on top of what's going on in the market. Now, like I explained to you before, we're talking about a process that many families will go through, and that is hospice. However, what I have found with my clients is most families don't understand how that process is going to go. So I wanted to bring on Dale Nee, who's the CEO of Covenant Hospice. Dale, welcome to the show.
Thanks, Andrew. Glad to be here.
Now, Dale, would you start off and tell us a little bit about yourself and how your journey over 20 years has been with Covenant?
Sure, be glad to. Well, I'm by profession a healthcare administrator. I've been involved in healthcare since actually 1971, and essentially a hospital administrator. And about 22 years ago, I made a decision that my interest was in the life care. And had opportunity. Hospice was a growing mission and movement at that time, and so I made a transition over to hospice care. Family and I moved here in 1993, and it's been a 20-year journey with Covenant Hospice.
Really? So you're not from here?
No, I'm from Central Florida.
Okay.
Gatorland.
Gatorland. They're struggling right now, though.
Well, we don't talk about that.
Okay, so over your 20 years, you've watched Covenant, and you've been leading the charge of growing Covenant. Covenant's grown leaps and bounds over the last 20 years, correct?
Yes, it has. When I arrived in 1993, we were caring for less than 120 patients in essentially about 10 counties. And today it ranges between 900 to 1,200 patients on a daily basis.
Wow.
And we're authorized to serve 50 counties, both in Florida and in southern Alabama.
And the organization has had such a positive impact through thousands of people's lives here in Escambia County and other counties. I can speak from experience. I absolutely love what Covenant does. I volunteer when I have an opportunity to. There's some really neat events y'all do to serve the community, and it's been there for my family when we lost a loved one this year. So Covenant Hospice has been a great organization and a real asset to Escambia County. But so many families don't know what hospice is. Can you kind of break down what is hospice, Dale?
Well, essentially, hospice is the word hospice itself is a method of providing health care and end-of-life care. And hospices, there are about 4,000 now in the United States. And hospices have a different, diverse way of providing care. But in the case of Covenant, we provide care in all settings. One of our goals has been over the years to be able to meet patients where they are and care for them, not necessarily expect them to come to us. And so because of that, not only do we care for patients in their own home, which is normally the family's preference, but we also have our own inpatient facilities, and then we have contractual arrangements with over 100 nursing and hospital facilities and assisted living facilities in both Florida and Alabama. So we're able to meet the patient's needs regardless of their circumstances.
Yeah, and that's one of those myths I hear all the time is, is hospice actually a place? No, they'll actually, take care of you where you're at, which is a real blessing to a lot of families because they don't want to leave their home a lot of times. Now, could you start us through kind of a stage-by-stage process through the end of life, starting with maybe, sadly, maybe breaking a hip, and take us through how that would look, going through the process of assisted living and skilled nursing?
Mm-hmm. Well, I think that there's two ways to define end-of-life care. Hospice is right now broadening our end-of-life continuum, if you will, and reaching out to patients who have life expectancies of perhaps several years. And you use the example of, let's say, an elderly person who breaks a hip, and then it's discovered that because of that fractured hip that they actually had metastatic bone disease, which created the fracture. And then we would take care of the patient at a certain point when perhaps aggressive curative measures were no longer determined by the patient and the family and the physicians to be a reasonable course of care. So that's when hospices step in and provide care with the emphasis on putting quality into life as opposed to necessarily life extension.
So when it becomes terminal is when hospice comes in?
Yes, there's two ways of looking at terminal. We can use the Medicare definition of terminal, which is a reimbursement definition, that basically the patient has to have 6 months or less of life expectancy in the best judgment of the physicians. But we know that terminal illness actually can occur over many years.
Sure.
And right now, as the population ages, there's a whole group of people who are maybe 3 or 4 years away from actually dying, who have multiple chronic diseases, the combination of which are going to create a terminal condition for them under the Medicare definition. And one of the things that Covenant wants to do and is doing is reaching out to those patients not only within the Medicare definition, but also earlier in the dying process.
Which kind of breaks the paradigm. Many families that know about hospice think that hospice only comes in the last week or so, the last 2 weeks maybe, but that's not the case.
No, it's not the case. Unfortunately, it is the case in some occasions, and then on the other hand, we have patients that might be with us a year or longer. On average, the average patient with Covenant is with us about 72 days. And of course, that then includes the patients that perhaps we get who die the same day that they're referred, and the longer stay patients. So really, in order to do what we're best at doing and putting quality into the patients' lives, the longer they're with us, the more successful we believe we are. But we think we know there's value even if the patient's only with us a few hours, because not only are we caring for the patient, we're also caring, as you know from your experience, for the patient's family.
Absolutely. And it's neat how y'all bring in actually a team of individuals to help take care of every facet of that grieving families, because they're emotionally strapped right there and they need a team. Could you share with us what that hospice team consists of?
Sure. And just as a side note, which ties into the team, hospice was really the first Medicare managed concept of healthcare in this country. And the idea was that an interdisciplinary team of healthcare professionals and volunteers would come together to provide this care that's called hospice care to individuals facing the end of their lives. So the range of physician, or the range of staff that we have can range from physicians through nurses, social workers, bereavement counselors, chaplains, and home health aides, physical therapists, occupational therapists, and then certainly our volunteers. Covenant has over 3,000 volunteers, and those volunteers under hospice care are allowed, with the right training, to actually help us provide care for the patient.
Wow. That's great to have, the chaplain to take care of that, and then have the social worker. It's nice when everyone's kind of on the same page.
Yes.
And then everyone can, help that family in every facet of life. Because, again, it's such a terrible time to go through, and you got to make it as pleasant and make those last, weeks, potentially months, the best months.
Yes. And that team also, one thing I should mention is that team, when they develop what we call the plan of care for the patient, that's reviewed literally every day. If the patient's in a nursing facility or an assisted living facility, they also will have plans of care for their residents. And what happens is that when Covenant goes in to take care of a patient who's in one of those facilities, we actually merge or join the care plans so that the two groups, let's say the nursing home staff and our staff, are meeting together and reviewing the patient's care and making sure that there's a comprehensive care plan for them.
That's fantastic. You talked about Medicare. How is hospice funded? Let's turn the focus to financially. How is that funded? How does the family pay for hospice? Do they pay for hospice? There's a lot of questions on the financial side.
Yeah. Well, and certainly about 75% of our patients are Medicare, and then we have Medicaid. We have TRICARE patients, and but we do have patients with private insurance. But in the case of Medicare, and frankly most of the payment sources, hospice is reimbursed on a unique per diem basis, a flat fee. So for every day a patient's with us, we get a certain fixed fee. And for that fixed fee, we then have to provide the range of services, which is essentially any medical services or psychosocial or spiritual care that the patient needs pertain to their terminal illness. So unlike other ways of providing for care, let's say in hospitals, hospice does not have the ability to bill for outliers and things that might be more expensive than you would expect. That's the challenge under the Medicare concept and under the managed care concept of getting that set payment, and within that payment being able to meet all the patient's needs.
So it's paid through Medicare on a per diem basis.
Yes.
So it doesn't come directly from the family. They don't have to pay for those services.
No. With Covenant Hospice, there's no copay, and we do not charge the patients for anything that we do as long as that care pertains to the terminal illness. We have, on rare occasions, the patient may still be getting some other types of care. And this is very important. For example, we may have a cancer patient who also has high blood pressure. The cancer, we're taking care of all those needs. The Medicare patient or the Medicare plan would still continue to pay for the high blood pressure treatment. So we also join in a way with Medicare and other providers to make sure all the patient's needs are met, but we're concentrating on the terminal illness.
If you're just tuning into What Your Money Would Say, we have Dale Nee from Covenant Hospice, and we're talking about how the process and the end of life goes and how hospice can add, the extra joy to that very traumatic time of losing a loved one. But Dale, I have a question. If a family's in a nursing home or assisted living, they still have to pay for those expenses, correct?
That's correct, unless, and I don't want to get too complicated, there's a higher level of care when the patient's condition becomes really acute, and we call that the inpatient level of care. When the patient is certified to be in the inpatient level of care, hospice actually is paying the nursing home for the room and board. But the great majority of our patients in nursing facilities on any given day, probably 90% of them, are having to pay still that out-of-pocket cost.
And most families don't know that those expenses are private pay. You know, Medicare is not going to pay for the assisted living
That's
or the
correct.
nursing home.
Yes, that's correct, and that certainly can be a burden. Now, it's not to say that we don't do our best to work with the families, and I think that's a benefit, because not only are we taking care, as I mentioned, the medical needs and the spiritual needs, our social workers are going to be working with the patients and their families and the nursing facility to ensure that there is a ability for the patient's family to pay or making arrangements. So we lend financial advisory assistance to them, and which relieves them, and it ties back into quality of life for them.
Absolutely. Because the last thing you want to worry about in those times is the financial matters,
Exactly.
the financial piece. And what I want to share with you, encourage you, is to call SWAN-Capital. What we like to do is sit down with a family and make sure that you're protected from these long-term care expenses so that when you get to this end-of-life stage, you're not worried about the financial aspect. And one of the ways we do that is through a long-term care insurance alternative. And let me explain how that would work. Many families understand how traditional long-term care works. They pay maybe $3,000 or $4,000, $5,000 a year, Dale, into the policy, and they may or may not ever use the policy, which scares a lot of families from long-term care.
Sure.
But what I want to share with families is, let's take $100,000 maybe that you have in a money market, a CD that's not earning anything, maybe 0.25%, right, these days. And what if we could invest it into a tool that if we needed the money, that $100,000 turns into $300,000 for long-term care expenses, tax-free. And what if we never use it? You can still get a really great return on your money, better than you're making in CDs, and you have that protection from long-term care expenses. If you want to find out more information about that long-term care insurance alternative, give SWAN-Capital a call at 850-380-9558. That's 850-380-9558.
Can be rough. One of the most important aspects
So
of
we'll
planning
come back.
is choosing the right guide to help you navigate the
I'll
road to
recap what we've
retirement.
talked about a little bit.
McNair and the
Okay.
team
And
at
then
SWAN-Capital
we'll
is
talk a little bit
dedicated
more
to
about some
providing the very
misconceptions
best
about
service
hospice.
in the
Right.
retirement
Okay.
And
planning
then
industry
we'll
today.
talk about
SWAN-Capital
all
is a
the
full-service
services y'all
independent wealth management
provide,
firm
maybe like the
dedicated
Leon
to
or
providing
veterans thing.
Okay.
guaranteed,
That's huge.
custom-made
Also,
plans
one
that you
thing that
cannot
we wanted
outlive.
to talk about
Contact
is
Andrew
the
McNair at
physicians. Do they have to give up their own physician?
Yeah.
How do we work on that? That's probably one of the I want to say potential barriers that
Yeah.
we have, the misinformation. They think they're going to have to give up their own
You
possessions,
should be enjoying your retirement years.
which some cases they do, but anyway, I can talk about
Yeah,
that.
what I'll do is I'll recap, then we'll, let's jump into some misconceptions and clear those up for families.
Okay.
Kind of pull back the curtain on what hospice is and what hospice
Okay.
isn't, and then I'll let you run with it.
Okay, that sounds good.
Again, that's 850-380-9558.
The Veteran Benefit
I keep
Project,
wanting to turn to you like
Andrew
I'm
McNair, president of
You can turn it to be comfortable. I know that's
Yeah, I
kind of
know.
awkward.
Got it over there.
helping
No, that's all right.
veterans and widows of veterans with long-term care expenses by qualifying for the VA's
I might,
paid
probably
independence
come up-
benefit.
call
Earn
478-3116.
$24,000 per year from the
Get some
VA
call then.
towards long-term health care. There is absolutely no fee associated with our assistance to the veteran, the widow of a veteran, their families, or any retirement community. Our goal is to preserve the dignity of the veteran and to
10 minutes.
You know, about 1/3 of our patients are veterans
Really?
on any given day.
That'd be a good thing to bring up when you talk about the Leon veterans.
Yeah, we have special programs just for veterans. We have a cadre of volunteers who do nothing. They're former veterans, or they are veterans, and they work with our veteran patients.
Cool.
It's a special, it's really great.
Sharon Oaks has told me a lot about what y'all do for veterans. I love it. My nonprofit, we help lots of families with the VA aid and attendance benefit.
Yeah.
Welcome back to What Your Money Would Say. I'm your host, Andrew McNair, and today I have the pleasure of bringing on Dale Nee from Covenant Hospice to talk about hospice. Now, we talked about briefly, what is hospice? We talked about the stages of care, what's paid for, what's not paid for. We talked about ways to protect yourself with a long-term care insurance alternative, but I wanted to jump into misconceptions about hospice. What hospice isn't, what hospice is, and kind of pull back the curtain for families that are unfamiliar with this process.
Sure, absolutely. Well, I think one of the major myths that we encounter is patients or families believing that they're going to have to give up their physician.
That's scary.
And it is very scary, particularly for the elderly population who may have had a relationship with their physician for 20, 30 years. And so that's a myth. That's not true. We do have our own physicians, about 30 physicians on our staff and nurse practitioners. And when we admit a patient, we do that in partnership with the patient's physician. Unless the patient's made a decision to leave their physician, which is rare. And so the care plan that I mentioned earlier includes the input of the patient's physician added to our own physician's assessment, and basically it's a collaboration. So it's a wonderful way of getting actually very well-rounded, comprehensive health care.
So it takes a team, and that's what's great is that if you're unfamiliar with the plan of care, could you tell the listeners what a plan of care actually is?
Plan of care essentially addresses the three main parts of hospice care that I mentioned. First of all, the medical needs, and so the care plan will identify exactly what the patient needs in terms of the medication, maybe especially bed, the types of equipment they might need, the frequency of nursing visits, the frequency of home health visits. It also then would include what we call the psychosocial care, which would be what are the needs of the family in terms of needing a social worker or needing even psychiatric or psychological care. If, for example, there's a patient that's admitted that may be talking suicide, we will then bring our psychologists in to help patients and families work through that. And then there's the spiritual side, which is non-denominational, very much like military chaplains. We call them chaplains. And they then either provide directly as needed spiritual care, or they facilitate with the different clergy or religious spiritual leaders in the community. It can be, it can be any denomination, any faith, and we've had a wide variety of that. So the care plan is a document that identifies all of these needs, how hospice is going to meet those needs, the frequency of the care, and as I said, it's formally updated at least every 2 weeks, but in some cases, literally every day.
Great. If you're just tuning in to What Your Money Would Say, we have Dale Nee, who's the CEO of Covenant Hospice, and we're talking about some of the misconceptions that surround hospice. And the first one is you don't lose your doctor unless you want to. But who is eligible?
Yes. Literally, with Covenant, anyone's eligible. We do not, if you will, discriminate against age, sex, any of the things that you might imagine. Including first and foremost ability to pay. We are a 501c3 charitable organization, so frankly reimbursement is one of the last questions we ask. And and as far as ages, we have children that are newborns, and we just celebrated the 100th birthday of a patient. So the age and disease, any disease that is categorized as a terminal illness is eligible for admission, and everything from cancer to end-stage dementia and all the diseases in between. And also I should mention that part of our team are bereavement counselors who will then continue to work with the patients and with the families after the patient has died.
And y'all do a great job of that. Y'all don't just do that for the first, couple of weeks after you've lost someone. You do that over a year basis.
Yes, or longer if the family needs that. And also we do a great deal of bereavement services, particularly for children, with the school systems. So the school systems refer children to us who may have had a death in the family, a car accident, suicide, or whatever, and we'll put them into our children's bereavement camps, and they can take part in our groups. So it's a way of covenant giving back to the communities that support us financially.
And speaking about being in the community, tell us some of the things that y'all are involved in the community.
Well, we try to stay very active, first of all, with cancer walks and heart disease. So, because one way or the other, all of the charitable organizations are interacting with one another. And so we try our best to have our staff and volunteers participate in other fundraising activities for other organizations, and try our best to support them. And so that's one way that we do it. We have a very special program with veterans. The We Honor Veterans program. Yes, the We Honor Veterans program, which includes about 150 volunteers who are veterans who do nothing but work with our veteran patients. And quite frankly, our veteran patients will open up to them about their needs much quicker than they will someone who hasn't perhaps experienced combat or someone that's been in the trenches. That's right. That's right. It's a wonderful program.
And that's important because we live in such a saturated community with veterans.
Yes, actually, on a given day, about 1/3 of our male patients are veterans, and of course females, quite a few, but 1/3 of the male patients, normally $250 to $300 a day, are actually veterans. It's Northwest Florida and Southern Alabama has the highest proportion of veterans of any place in the country in terms of the population.
Well, I appreciate your commitment to the veterans. I've seen it firsthand. My nonprofit organization, the Veteran Benefit Project, we help families, receive up to $24,000 a year from the VA to help pay for assisted living, skilled nursing. Yeah. And when I go into those places, a lot of times I'll see around, when we have Veterans Day, a lot of Covenant Hospice volunteers right there, giving out cake, giving out different things to the veterans. Yeah. I think that's fantastic.
Yeah. And one thing I think, just very quickly, that's very special, unfortunately, when we do have a death and one of our veteran volunteers is available, they'll either go into the home or into the facility, and as the funeral home is taking the body out in a coffin or in a container, we have American flags that they drape over that. And I think those are just very special things that we try to do, not only honoring the life and service of the patient, but also for the family.
The last misconception I want to talk about is the cost. So again, some families think that hospice, all these great things that y'all do for families, has to be paid by someone, and they think they may have to pay for it themselves. Can you talk about that?
Yeah. Once again, the majority of our patients are qualified either under a federal program or a state program. Of course, now with the Affordable Care Act, a lot of those things are in flux, but I'm comfortable that hospice is going to continue to have a.
So was it really affected? I mean,
no, we've been affected by the cuts, but we haven't yet been affected by the actual legislation. I'm optimistic that we won't be. But of course, there's still a lot of unknowns. But essentially,
there still probably hasn't someone that's read the whole thing either.
No, that's right. Unfortunately, I think I have. But we provide about $1.8 million a year in indigent care for patients that don't have that. But once again, we really try to do our best to make sure that ability to pay is the last question we ask when we're admitting a patient. Yeah.
You should worry about taking care of them spiritually, physically and mentally. Mm-hmm. The last thing is financially.
That's right.
And that's the same thing I tell my clients. When it comes to retirement or estate planning, you should enjoy the pleasures of retirement and let me take care of the responsibilities of your retirement. Yep. And if you're worried about financially, how do you pay for assisted living, skilled nursing, or home health care? I want to share with you a long-term care alternative. If you have CDs or money markets, maybe $100,000 invested there, and you're just fed up with them only making less than 1%, let me give you an alternative. What if we could get better than CD rates, better than 1%? But if we ever needed those monies for long-term care, it would triple. that 100,000 would turn into 300,000. If that's an alternative you want to look into, give SWAN-Capital a call at 380-9558. That's 380-9558. Well, Dale, we talked a lot about hospice, and if you will, share with them your website and how they can get in contact with someone at Covenant.
Sure. It's pretty simple, covenanthospice.org, and our number here in Pensacola area is 433-2155. I want, before we get off the air, thank you for your company and everything you do, but even more importantly, your volunteerism with Covenant Hospice, and also tell you it was an honor and very humble pleasure to be able to serve you and your family. So, thank you.
Thanks again for coming on the show.
Okay.
That thing flew by.
Yeah, thank you so much. Yeah.
Absolutely.
Yeah.
Well, again, thank you for leading Covenant Hospice. Again, what y'all do is just amazing.
Oh, thank you.
I'll go in there, because I probably go to all assisted living maybe once a week. And
Do you?
if there's ever any, we're going on Memorial Day, I always think of the hospice. Volunteers.
Yeah, yeah.
That's so good.
Yeah, it's great. I'm gonna miss it. No doubt about it. But it's time to. I'm sure there's someone much smarter than me.
Oh, I don't know about that.
To take off on. Well, no, I wasn't looking for a compliment.
Have y'all even found anybody?
No, they've been searching for a year.
Really?
And so I'm gonna stay on as a very limited consultant just with the board, just for major things, and I'll remain a member of the search committee. But no, we've interviewed, actually physically interviewed about 20 people, and they just haven't found
Hard to find the right person.
Yeah, it's challenging. So you take care.
Again, thanks for coming on the show.
Yes, sir. Thank you. Appreciate it. Thank you. Good to
have a
meet
good
you.
one.
Okay, you take care.
All right, you too.
Thank you, Stacy. Awesome show.
85-year-old Korean war vet was arrested on a visit to North Korea, detained for more than 40 days.